Hi, the next part of the personality disorder is this causes and the treatment. So let's see, discuss that what are the some of the causes of personality disorder and how we can treat them or fix them. Causes of personality disorders. Research suggests that genetics, abuse, and other factors contribute to personality disorders. So, genetics is a malfunctioning genes may be a factor in obsessive compulsive disorder or genetic links to aggression, anxiety, and fear. So some of the personality disorders may be linked with our genes or they are maybe genetic. Then childhood traumas. A link has been found between childhood traumas and the development of personality disorders like borderline personality disorder. So these are there could be another reason that you have faced some traumas, some shocks, some different things in your childhood, so that may be resulted into your personality disorder like borderline personality disorder. Then verbal abuse. Children who have experienced verbal abuses are three times as likely other children to have borderline or narcissistic or obsessive compulsive or paranoid personality disorder in adulthood. So if it is there in the childhood, if they have faced verbal abuse from other people, maybe their parents or their elder brothers or people with whom they are living, so it might be turn into be some kind of personality disorder like narcissistic, borderline, or obsessive or compulsion or paranoid personality disorder when you grown up. So then the next one is the high reactivity. Overly sensitive children who have what researchers called high reactivity are more likely to develop shyness, timid, or anxious personalities. So these are the children who are oversensitive. So they might become shy and have timid. Timid mean they can got we can also divide the causes of personality disorder into four different categories like biological, psychological, physical, and social cultural. So like we have discussed, in biological is a genetic and heredity factors, family history of personality disorders, alternation in neurotransmitters, chemical substances. So these are the few of the factors which are biological, and they are also causes of personality disorder. The next one is psychological. Childhood trauma, parental rejection, child's neglect, PTSD, alcoholic parents, excessive parental control, upbringing, fixation at any stage, and low self-esteem. So these are the few of the psychological factors which which can lead to a personality disorder. Then physical is brain dysfunctioning, then childhood pathology or psychiatric disorder. So these are something related to our physics, which is brain or other things. Then social cultural factors are involuntary isolation. If you put someone in involuntary isolation, divorce, broken homes and families, prolonged separation, deprivation, internal conflicts, assault, experience to loss and death. So these are some factors which are coming from our society of our living. So these are the put together, all these causes are which may result into personality disorder. After discussing the causes of personality disorder, let's see what are the some of the treatments we have to take care of these personality disorders. So before starting the treatment for personality disorder, first step is to diagnose the personality disorder. So before start of treatment requires a mental health professional looking at long-term pattern of functioning and the symptoms. So it's very important that you should go to a when first of all you have identify, and then you go to a professional person who can diagnose the things. So diagnosis is typically made in individual 18 or older, because people under 18s are typically not diagnosed with personality disorder because their personalities are still developing. So it is must be done in the adulthood after 18, because there are chances that you might change. So it will be good to you will be go to doctor or to diagnose after 18 years. Some people with a personality disorder may not recognize a problem. So there's a problem in diagnosing that. Maybe most of us don't even accept that we have some kind of personality disorder. Also, people may have more than one personality disorder. Of course, it is it is like scientifically separated the things are, but basically maybe we have a set of disorders, or maybe we have more than one disorder. So these are the things we have to check before going for the treatment. So treatment of personality disorders, the type of treatment will depend on the specific personality disorder. Like we have discussed in the previous slide that first of all we have to diagnose, and we have to do the treatment according to our diagnosis, how severe it is, and the individual circumstances. So we have to first do a detailed diagnostic things about the personality disorder. Then we have to recommend that what kind of treatment is required. So these are the few of the few of the treatments. These are like psychotherapy, medication, self-caring and coping strategies, and then next is the family help. So these are like four major things which we can professional can recommend, that therapy, medicines, then self-control and other strategies to overcome these disorders, and then help from the family. So let's discuss one by one this in the next section. Psychotherapy is a certain type of psychotherapies are effective for treating personality disorders. During the psychotherapy, an individual can gain insight and knowledge about the disorder and what is contributing to symptoms, and can talk about the thoughts, feeling and behavior. So basically in this psychotherapy, the practitioners are go through the things which about the causes, about the history and things like that, your feeling, thoughts and behavior. So first they take all your history, and then psychotherapy can help a person understand the effects of their behavior on other, and learn to manage or cope with symptoms and reduce behavior causing problem with functioning and relationship. So then after diagnose, or after getting the history of that individual person, the expert can help you to understand that what kind of effects when you are behaving like this, what is happening to the other people. So then they suggest you that how you can control your behavior, or then or how you function better, or how you should behave in those kind of situations. So here are some commonly used types of psychotherapy. Is that then first is the psychoanalytic or psychodynamic therapy, dialectical behavior therapy, cognitive behavior therapy, group therapy, then psychoeducation, teaching the individual and family members about the illness, treatment of the way of coping. So these are the some kind of psychotherapies which we can get to fix the personality disorders. Okay, the next one is medication. There are no medication specifically to treat the personality disorders. Yeah, there are no specific. There's no medicines are produced or made to cope with the personality disorder. However, medications such as antidepressants, anti-anxiety medications, or mood stabilizing medications may be helpful in treating some symptoms. So actually it is to those medicines which help to reduce those kind of thinking and behavior. That is like antidepressant, that is like which are if you are depressed, they make you happy. If you have a feeling anxiety, it will reduce your anxiety. And then some of medicines are which make your mood stable. So more severe or long-lasting symptoms may require a team approach involving a primary care doctor, a psychiatrist, or a psychologist, social worker, or family members. So if medicines are with medicine, we have to do other things as well, like therapy and involving other specialists in the treatment, including your. Then you will need some strategies or some exercises, so we should do ourselves to take care of our disorders, personality disorders. Learn about the condition. Knowledge and understanding can help empower and motivate. So first of all, you should have the knowledge of your condition. It is very important. And then acceptance. Sometimes we are mode of denial, so we don't even accept, so we cannot fix it. So get active. Physical activities and exercise can help manage many symptoms such as depression, stress, and anxiety. So avoid drugs and alcohol. If someone is taking drugs or alcohol, so illegal drugs, so can worsen the symptoms or interact with the medication. So this is the first thing, that you should leave quit these kind of things. Get routine medical care. Don't neglect checkups or regular care for your family or doctor. So you should take the this treatment regularly. Join a sport group of other with the personality disorders. Yeah, it is another remedy or another exercise, that just go the group which people are already getting rehabilitation, so you can go and join with that. Write in a journal to express your emotions. So it should be vent, let your emotion should be out. So try relaxation and stress management techniques such as yoga and meditation. Then stay connected with family and friends and avoid become isolated. So these are the few of the self-caring and coping strategies which you can adopt to fix the personality disorder. Last but not the least, so this is family help is very important. That is your support group, so which can help you to get rid of this personality disorders, or or minimize the causes of those personality disorder. Family members can be important in an individual's recovery and can work with the family's healthcare provider on the most effective way to help and support. But having a family member with a personality disorder can also distressing and stressful. So be careful that if other family members are also have a personality disorder, that is like, if they are with them, then maybe it can worsen the situation. Family member may benefit from talking with a mental health provider who can provide help coping with the difficulty. So it's good that other family members should talk with the expert, or who is providing the help, so that way they have a understanding of the situation and they can behave likewise. So these are the few therapy, medication and self caring and coping strategies, and then family help is very important to treat the personality disorder. So in the last portion, I will ask you, do you know the causes? If you have personality disorders, do you know the causes, and do you want to have a treatment? So I'm leaving this question to all of us. So first of all, in the first part of this lecture, we discussed the types of personality disorder. In this part of the lecture, we have discussed the causes and then treatment. So you have to see that if if you have any personality disorder, and then go back and check the causes of that, and then try to remove those causes if they are still presently there. Stay away from those causes, and then you start a treatment to so your rehabilitation should be started. So these are the, this is the end of my lecture on personality disorder part 2. So I hope you have no better understanding of the causes and the treatment of the personality disorder. Thank you.